Good morning. Good afternoon.
Hi, Alain. How are you?
Great.
Best regards from Panama City. We have an amazing group of people here from 20 countries waiting
Thank
for
you.
your presentation. So I leave the floor open for you. Thank you very much.
Thank you so much. My warm regards to everyone there in Panama City. I'm so sad that I cannot be with you in person. I would have loved to accept this gracious invitation from RECAINSA to join you, but as I told Danielle, my wife would not let me back in the house if I was away for another day. So, having traveled for quite so long, I've been on the road for almost a month now, and it was time to come home and do some work here at WHO. So, delighted to be here. And so today, thought I would just share with you some of the perspectives of work that's going on here at WHO to support member states in this journey of digital health transformation. So if you will just bear with me for one moment, I will just share my screen, and then we can move forward. So I believe this is the right screen. Yeah, so let me know if you can hear me and see me, and then I will continue. So really thanks again to RECAINSA for inviting me, and it's really a pleasure to be, I think, among so many fellow researchers and champions of digital health and innovation, and like I always like to say, this is a fellow digital geeks and world changers. So the world has changed, and these last 4 years have shown us. Sorry. These last 4 years, Joseline is sending me WhatsApp, so that's what's dinging in the background. The last 4 years in COVID have really shown us that despite being apart and isolated and scrambling to respond to a pandemic, we have learned many things, and if anything, there's a silver lining to the pandemic, and that is that we are at a digital inflection point. So at WHO, what we are hearing from countries is how do we move out of a state of fragmented experimentation towards systematic government-led digital transformation, and so that's what hopefully I'll be speaking to you today. And in many ways, thanks to the mobile phone revolution, the concepts that we have about the last mile and hard to reach populations have really been challenged and redefined, and has brought to the table the new meaning for person centricity. So across many sectors, we've seen this in banking and education and entertainment. These technologies, these very powerful technologies in the palm of our hands, give people everywhere access to information, help the health system connect with people, and really extend our understanding of what can be done with technologies. So several years ago, as we began examining the evidence for digital health, in order to recommend these strategies to ministries of health, we began to propose thinking differently. Given that we have a paradigm of interventions of known efficacy here on the bottom left, you'll see that as a public health system, our goal is to try to get these interventions, whether these are technologies or drugs or strategies that reduce morbidity and mortality. Our goal is always to try and get these interventions to reach high levels of quality and coverage in populations. But in trying to do so, we face problems. We face potholes in the highway from here to here. And these potholes can be very, very different depending on where we are, from poor demand for services, failure to follow guidelines, stockouts of commodities or workforce training, etc. And these health system challenges are the reason why we look to find solutions that can help fill those potholes. And so we see these as digital health interventions. These are the strategies by which we address the health system challenges that prevent us from reaching high quality coverage of those health interventions. But stepping back, as we look at, where do these systems come together as we look to strengthen health systems? WHO is looking for certain things, ministries of health are looking for other things, technology players in the space, health workers, health service users. And if we take a look at these bullets that I've put on the slide here, I'm not going to read them all to you because your eyes are faster than my voice. You can see that each of the actors in a future health system is looking for different things. And together, when all of these things congeal, we ultimately end up with better things for the end users. The person at the very end here who's looking to receive higher quality health services, who wants control and access over personal health data and decision making, who wants to experience continuous care and cross-border health information portability, but also access to trustworthy information about how and what to do to manage and maintain their health. So I think from ministries of health to WHO to health workers, we all recognize that there's a digitized future in store that we can help to advance. And so member states' requests for leadership in digital health spans over 20 years. When we go back to the early 2000s, World Health Assembly resolutions on e-health, on digital health, on e-health standardization and interoperability, all of which led to the 2020-2025 global strategy on digital health, which really articulated the member states' vision for what WHO as a secretariat, but also what partners in the ecosystem, including RECAINSA, including member states, need to be doing to move us towards digital transformation away from digital experimentation. WHO has had the privilege of playing a stewardship role in developing some of the norms and standards that advance digital health from projects to transformation, starting with what might be very familiar to all of you in the room, the famous National eHealth Strategy Toolkit with the 7 building blocks for the enabling environment for digital health, followed by the classification of digital health interventions that now is in version 2, just released 2 weeks ago, as well as the evidence-based recommendations for digital health system strengthening that was launched in 2019 that I'll speak a little bit about in a moment. But we also have developed things like implementation and investment guides, how to plan and execute a costed digital health strategy, as well as how to monitor and evaluate digital health solutions being implemented at scale in countries. So let me start with the guideline that hopefully all of you are familiar with, that recommends 10 key interventions that have a strong evidence base that these strategies can help strengthen health systems using digital technologies, from birth and death notification here on the top, but throughout the life course, giving people access to information with targeted client communication, peer-to-peer and client-to-provider telemedicine, stock notification and commodity management, training and support of health workers with targeted knowledge, and then decision support tools at the point of care, together with longitudinal tracking and targeted client communication packaged together as part of a service delivery activity on the ground. So this document has some really strong recommendations that hopefully as each of you is working both to advance the cause of digital health and health system strengthening, but also trying to make the argument to ministries of finance, to donor agencies, the fact that there are WHO guidelines should help you present a very strong case to that effect. But even recently, documents such as the World Bank's report on digital in health, that I think is one of the really fantastic pieces of work that came out this year, describes this ecosystem of why. Why should we invest in digital health? Because it strengthens data streams, which ultimately help improve individual health outcomes. That helps reimagine how health workers deliver services on the ground. Many times, the systems that we use to deliver primary health care were created in an era where paper was the norm, and therefore the systems themselves reflect a time that was paper-based and not digital. Can we use digital to improve health financing, but also to improve accountability of the money that's being spent in digital? And can we use digital to accelerate earlier and better, not just individual health, but public health actions? I think, as I said earlier, COVID-19 unlocked the global potential of digital health, building confidence and demonstrating impact of what these technologies could do in the sphere of public health. And you can see here a paper from Bud and colleagues a few years ago that really captured the universe of different ways in which digital technologies was being used to combat the COVID-19 pandemic. But I think the thing that I will really emphasize that this report brought to the forefront was data from some analysis that was done on digital adoption indices. So digital adoption index, which is a measure of how sophisticated the digital ecosystem in a country was prior to the pandemic. And what this demonstrated was the digital adoption index was a prominent feature in predicting the trajectory of the pandemic in terms of new cases and in terms of the severity of outcomes of those cases, adjusted for the level of economic sophistication in that country. So digital readiness does more than just make a health system more efficient. It can also help improve the way we reduce the impact of grave health insults. So I think this quote for me says, speaks volumes, that we have now reached a stage after these 4 years of experiences built on 20 years of collective work that many of you in the room today have contributed to, that we need to think beyond just enhancing health systems through individual digital health solutions, but we need to think about digital as a transformer of health systems in a broader sense. Digital being baked into everything we do. And it's not something very, very future thinking to propose, because if we look at the banking sector, if we look at the education sector, those areas have undertaken this transformation wholeheartedly in many parts of the globe, where digital is the way in which financial services are delivered. So why do we not say the same for health? Part of that is because we need to invest in the foundations. And so when you think about the way to conceive of the foundations, it's the fertility of the soil in which the seeds of innovation, the seeds of digital technology are being planted. Do we have the right components in place to ensure that those seeds will grow and thrive into the trees that we hope they will, to provide the fruit and shelter that those trees ultimately do? So going back to this seminal document from 2012, many of you will remember these 7 pillars that have been referred to as the key enabling foundations for a digital ecosystem. But we've come a long way since 2012, and there are new and more sophisticated frameworks for us to be thinking about. IQVIA recently published a monograph on digital health systems in Africa, where they break these foundations into enabling policies and frameworks, to platforms and standards, as well as applications of data and tools that exist on top of this very, very fertile soil. And so we think about the policies, the funding, the data governance, the institutions, and the legal frameworks that have to be in place, together with the universal IDs or electronic health records, the data standards, interoperability, connectivity, workforce, et cetera, that allows all of the applications to then be used on top of those systems. PAHO has identified 8 principles for digital transformation that overlap somewhat with these principles, but they also offer some additional insights, including things like information security, human rights, and the public health architecture that has to be there in order for the digital health architecture to have an efficient and impactful impact on the population. So one of the ways that when we talk about this transition from siloed experimentation to a cohesive and well-coordinated national health system infrastructure, it's really moving from a state of technical debt to one of economies of scale. And so the case in many countries in the past was this state of what we call MUD, monolithic, unarchitected software distribution. A lot of software that overlaps with each other, trying to achieve project goals, but these are siloed within health verticals or within geographies of large countries. And as we move from this siloed paradigm to an integrated paradigm, there is this introduction of shared services. So services that are managed and maintained as part of enterprise architecture, either by government or by groups that have been given that authority by government to maintain workforce registries, facility registries, payment backbones, unique identifiers, under a paradigm of common shared standards and interoperability that then different applications can plug into, but also then share information horizontally so that patients moving through the system using different applications can enter their information once and have that information be used when appropriate over and over again to optimize their care experience. Now, when we want to look at the maturity of these foundations, there are a number of different tools that have emerged. And I know the PAHO region has an information health system assessment tool that has been used by many member states. At WHO, we, as part of this new global initiative on digital health, we have been working very closely with the Global Digital Health Monitor that some of you are familiar with. And you can Google this and it would come up as the website you see here on the screen. Now, what this does is use those 7 pillars, but for each of these pillars, there are a number of very detailed indicators that if you were to click on this link, you would see those indicators that help measure where countries are in these overall building blocks, but also as a whole, bringing an average of all the indicators together. Now, in the report from the World Bank that I shared with you a moment ago, they use the same Global Digital Health Monitor to evaluate by income status of the countries, where countries stand across these 7 building blocks. And as you might imagine, there is a state of maturity that is aligned for the high income countries, at least, with the level of maturity across these 7 areas. And so this is something that we need to continue to work on to reduce this disparity that's associated with the country GDP status. Overall, looking at it by region, we see that the Euro region has achieved a maturity level of phase 4. No one is really in phase 5 yet, which means we all have room to grow. But we can see that the rest of the world is also not falling too far behind in terms of being at a stage 3 of overall maturity. So investments are being made in digital across most countries, but there needs to be continued and greater investment to help countries reach full maturity. We need to improve cross-country and regional learning between countries that are advanced and countries that are working to reach those levels of advanced operations. Leadership and governance are relatively mature globally, but those investments continue to be needed. Strategy and investment is a problem that sometimes will cause this state of experimentation, because there only is enough money to do an experiment and not to really build a solid foundation or a robust enterprise grade system. Data protection and cybersecurity legislation is fairly mature, but there's more needed in terms of and legislations around the emerging areas, including artificial intelligence and cross-border data sharing. Workforce is an area of low maturity across most countries. And this is where we have neglected, and really groups like RECAINSA, I think, are pushing the envelope to ensure that we are training the future generations of health workers for the health systems that we are envisaging. And that means making sure that we are both creating pre-service and in-service training options for that health workforce. And then you can see here standards and interoperability, infrastructure, and services and applications also need continued investment. Now, switching tracks, I mean, let's go back for a moment to the global strategy. And so as we are approaching 2025, one of my requests to each of you in the room, and I heard someone say at the beginning that there are 20 member states, right, Jocelyn, in the room, and I think it's now is the time. We're at the midpoint of this member state strategy for you all to take a careful look at where we are in this roadmap. What have we done well, and what are the areas where we can continue to invest efforts collectively as WHO, as member states, and as partners to digital transformation, so that when 2025 comes around, we will be able to proudly state that we put all of our efforts into achieving this shared global strategy. Now, one of the ways we really are emphasizing with member states to achieve that vision of a transformed health system is to follow a systematic blueprint. And I think this is where government leadership is critical. It's only government that can help look at the national health priorities and the digital maturity of the country, together with the quality of the building blocks that are in place, bringing together the priorities and the maturity in an articulated and costed digital strategy. Apologize, I'm having messages popping up everywhere. But the strategy is what informs an investment roadmap. The investment roadmap is what informs an enterprise architecture that we just spoke about, that sort of architected approach. And this leads to the sea of interconnected applications that can be built by the public sector, that can be built by entrepreneurs and the private sector, but eventually all working together in providing a person-centered experience to that life continuum of care, thanks to the fact that these predecessors are well established. So I'm going to close by giving you 3 quick examples of areas of work that I think you all will find very exciting. And hopefully we will, at the end of this RECAINSA annual meeting, we will have a lot of questions and a lot more support and participation from each of you in helping to build and further this agenda. First, let me proudly share with you the new Global Digital Health Certification Network. And I know there's a upcoming LACPAS Connectathon that is going to look at really increasing the number of South American and Latin American countries working to join this trust architecture. But this is an essential piece of global health infrastructure that allows citizens to carry their credentialed health information across borders to other countries that are part of this network. And during the pandemic, there were many smaller networks that were set up to provide this service which in July of 2023, WHO took this on as a piece of digital public infrastructure for the world in service of our 194 member states. So in summary, how this works, it's public key infrastructure. So if you used a passport to come to this meeting, if you used your Visa card to pay for a hotel, you use the benefits of a public key infrastructure. ICAO, the International Passport Agency, maintains the public key infrastructure for the global system of national passports. And so with this approach, what we are doing is learning from the highly successful example of the pandemic, where regional trust networks were able to use QR codes, enabling individuals to move from country to country with proof that they had been vaccinated or tested negative. And this allows us to now expand that facility to things like a digital yellow card or childhood vaccine certificates, or even an international patient summary that brings together key pieces of information that can be used when individuals are traveling across borders. The way this works is countries, and we have an onboarding process that I'll share the QR code for in just a moment, an onboarding process where countries submit their public key of who is the authorized issuer of credentials in that country. WHO is the phone book of these public keys. We receive them from the credential authority and we certify the provenance of that public key. We then publish the list of public keys to all members of the network in an open and transparent way. And then because each country has a bilateral relationship with the trust anchor, in this case, WHO, countries can then trust each other through that process of transitive trust. That because they have trust individually with WHO, you can trust one another in exchanging those certificates moderated by individuals. And that's really the most important key, is that individuals carrying QR code containing data. And so if you want to scan this one, you'll be able to see an example of what an international patient summary looks like. The patient is the one mediating the consent to access their data when and where it is appropriate and when and where it is useful for that individual to share that information. So we already now have about 55 countries onboarded since the system went live in September, so a little over a month and a half ago. And every day we are getting more countries joining this network for the future use cases that we're very excited about. So if you're interested in this, here's the QR code. Feel free to scan it, and it will take you to a GitHub repository that has all of the information about the technical specifications and how to join the certification network. Next, I want to talk about SMART guidelines. And so as many of you know, WHO has for decades published guidelines for governments, for ministries of health, for technical agencies to implement programs, whether these are immunization programs, maternal and child health programs, non-communicable disease programs. We bring the best minds of the world together, the leading technical experts who come together, review the evidence, and produce what you see here in L1, level 1 of SMART guidelines, which is the paper-based narrative guidelines on what to do, when to do it. Now, as you also may know, these books sometimes sit on the shelf for months, if not years, before they are translated into action on the ground. And so over these last few years, we have been developing these SMART guidelines, so standards-based, machine-readable, adaptive, requirements-based, and testable guidelines, which make these narrative guidelines much more operational. So in level 2, we create flow diagrams and swim lane diagrams that describe the different decision processes and actions that need to be taken. So standardizing that preparing to go digital through the standardized presentation of information. But then L3 is where it gets most exciting, where governments and entrepreneurs can download directly from WHO machine-readable, updated guidelines that can be incorporated into digital software that is executed on the ground in the country with the wrapper that's appropriate for Bolivia, for Peru, for Argentina, based on whatever wrapper the country wants to place around that machine-readable guidelines. We're also helping to develop customizable but reference software that again can be manipulated and adjusted to the needs of specific countries as part of their digital health ecosystem. These are all FHIR IGs that allow for interoperability across disease verticals using common data models for representation of things like patient identifiers and other key parts of a transferable but continuous health record. All of this ultimately leads towards that end vision of an L5 where good quality data available in a timely way can lead to precision public health and precision medicine and all of the AI tools that we keep talking about. But with garbage in, we get garbage out. So this is an effort to improve the quality of data that is available. So very, very quickly, here's a narrative guideline. Here's the components of a L2 or a digital adaptation kit, that many of which are available on our website. An example of what's inside of a digital adaptation kit in terms of workflows, and then the specific computable guidelines that are then converted into FHIR IGs. And here's an example of the machine readable format you see here in software code. And what's exciting is once these systems get up and running, we end up with the ability for provider-based applications to crosstalk with individual-based applications, such as personal health wallets, or as I mentioned earlier, the International Patient Summary, that can draw directly from information that's collected by providers at the point of care. So an exciting future where we move from this idea of siloed, disconnected solutions, which have to be custom adapted to each other to connect them because they're not using a standards-based environment, to a future where we are working with a standards-based architecture in a building blocks approach. And you see here, we've used the sort of Lego image to show how everything plugs together nicely because we're using both syntactic and semantic interoperability. And so there's an entire ecosystem that we're working on building, including software development kits. One of the software development kits that was launched earlier this year, an Android Fire-based SDK, which is called Open Health Stack, was developed by Google as a way of providing this service to populations everywhere. Again, it's just an SDK. They're not developing software, but it enables entrepreneurs on the ground in Panama, in Bolivia, in Peru, in Chile to build these solutions in country, as opposed to importing them from outside. So if you want more information, here's the QR code, and I'll just pause for a second. I know you all have your phones out, so you can have access to that. Now, very, very quickly, here is the new classification of digital health. This is a very interdisciplinary field, and so unless we speak a common language, it's often we're not talking to each other, we're talking past each other. And so this just was released a few weeks ago in our meetings in Southern Africa, and it's now available online for global use. It contains a taxonomy of health system challenges, different types of applications, and detailed interventions, digital interventions for users, providers, for managers, and for data services. So hopefully this is something that is also going to soon be available in Spanish, Portuguese, Arabic, and Chinese. And so we'll have this widely useful across the globe as a standardized set of languages. Now, last but not least, shifting to artificial intelligence. WHO has been involved since 2018 in understanding the opportunities that AI presents for improving health systems globally. And recently, just a few months ago, we launched a new global initiative on AI for health. And so this takes the focus group that was in place from 2018, helping to build recommendations for policies and technical guidance across these many different areas you see at the bottom, from cardiology to diabetes to dermatology, all the way to higher order guidance around regulatory considerations, around training data sets and best practices, all the way to the ethics and regulatory best practices for AI, into now a global initiative bringing many more people and organizations together under this umbrella. To date, WHO has launched 3 key pieces of technical guidance that you see here illustrated on the screen. One is around ethics and governance. The other is around how to generate evidence for AI-based medical devices. And the one that was just launched a few weeks ago is regulatory considerations on AI for health. There's also a training course for anyone who wants to get their feet wet in terms of AI ethics. And this course has been now taken over 16,000 times by people around the world. And you're more than welcome to scan this QR code and have access to that resource. These principles for ethical use of AI is something that is a hot topic, as you know. Many governments are asking, what do we do in order to create an environment that protects people while also allowing the power of AI to be used to strengthen health systems? And so this is a piece of guidance that I think is really nicely put together, and hopefully you will find a great deal of value in. In terms of regulatory considerations, one of the things we have to consider is that the regulatory systems that we have today were not built for learning technologies. They were built for technologies that once they demonstrate validity, once they demonstrate performance, they continue to perform in that same way, in a predictable way over time. And with learning models, one of the things we need to make sure is that we have post-deployment monitoring to ensure that data continuously is being understood in terms of real-world performance, and that there are feedback loops that go back to the model training and validation as the models continue to evolve in sophistication. But last, I want to leave you with the exciting frontier, and that is the fact that digital health only works when we have partnerships. And this is why I'm really delighted to be here today, working with colleagues at RECAINSA, and hopefully in the near future, meeting each and every one of you and understanding how we can support your desires to help shepherd a national digital transformation. We've launched the Global Initiative on Digital Health as part of the G20 process this year, which many Latin American countries and North American countries were involved in advocating for, because of the great enthusiasm for digital health, but also the great risk that this field devolves into an entropic situation with a lot of people pulling the cart in many different directions, where we should in fact be learning from each other and amplifying all of our best practices and knowledge as a global community. And so one of the actions that we're trying to do is make sure that this GIDH or guide addresses many of the actions that have been articulated in the global strategy on digital health. We'll be working closely to identify some lighthouse countries in which we can develop and refine and test a country needs tracker to really articulate what are the country priority areas for investment, making sure we can align resources to support countries in that quest, making sure that governments have the tools they need to help steward that process of change. And this includes access to maturity models, to a tracking or digital health atlas to map all of the activities at the country level, and then global platforms for knowledge sharing like you are currently involved in, but helping to bring together the fantastic networks like RECAINSA, like AHIN, like Helena, around the world that are working closely with governments to help both peer learning, but also to bring quality assured technical assistance to the table. For lack of time, I'm just going to show you some of the tools that we're developing. I've already spoken about the digital health monitor. There's a new and improved digital health atlas that we're developing. Again, 4 countries to be able to track both interoperable and non-interoperable solutions that are currently in place in their countries. We're working to build a digital health clearinghouse for smart guidelines compliant software to allow you to find reference softwares that are being developed around the world that have been evaluated to demonstrate that they are aligned to national standards. And we continue to work with private sector and other global leads, such as Google, such as Meta, such as Microsoft, to really ensure that there's a public-private partnership in bringing the best technologies to you on the ground where you're trying to solve problems. I will leave you with a few calls to action. And I think for those of you at RECAINSA, if you go to the back of this global strategy manual, you will see that there are proposed actions for member states, for us, the Secretariat at WHO and PAHO and all of the other regional offices, as well as to other partners, NGOs and implementing organizations working on digital health transformation. You can see here that for each of the 4 strategic objectives, there are areas that are relevant to you as RECAINSA participants, both short, medium, and long-term goals that you can all help us as a global community advance. How to advance national digital health strategies, working with ministries and other partners, and how to strengthen governance of digital health as members of a network like RECAINSA. And then for advocating for people-centered health systems, what I've done here is identified a few areas that I think we all can work together. And Jocelyn and Danielle, you will have these to look into in more detail. And there may be other areas that I haven't highlighted that the members of RECAINSA can help collectively advance this objective. Thank you so very much for this time and attention that you've kindly given me. I just want to leave you with a reminder that the work that you are doing is not just building technology-based systems or applications or infrastructure, but it is actually saving lives. Good, well-designed digital health solutions have been shown to reduce morbidity and mortality in countries around the world, and each of you consider yourselves to be in the business of saving lives. So with that, thank you so much. Muchas gracias. And I will thank you for inviting me once again.
Thank you very much, Alain. This is Jocelyn here from Panama City, missing you. So I would like to open the floor for a few questions. We have more than 120 professionals here from 20 countries. So I'm pretty sure that they would like to take the opportunity to ask you about all these initiatives and technical guidance that you have just shared with us. So, quisiera saber si tienen preguntas para el Dr. Labrique, por favor. Creo que es un buen momento para que aprovechemos y hagamos preguntas que nos interesan en los países de nuestra región. We have a question here. Alain, from Daniel.
Sí.
Hi.
Me encantan las preguntas, pero no siempre tengo todas las respuestas. So I will try.
Hi, Alan. Nice to having you remotely. Thank you very much for the effort. I'm Daniel Otsoy. I think that you mentioned the role of the regional networks in terms of promote all those digital goods that WHO and other partners are promoting. But I would like to know specifically how the regional network can support the connection with the local ecosystem, those regional initiatives, and the global initiatives. Thank you very much.
Yeah, no, absolutely. And I think it's a very good question. Each of us has a role to play. And so that's why I ended today's talk with highlighting the areas of the global strategy that I think make the shared roles and responsibility of all of us in helping to shepherd a digital transformation very, very clear. As we all look at that library, and I would love for RECAINSA to help us as we are developing our final report on the global strategy, to work with its members on the ground, in the communities, to identify the actions that have been taken at the country level across the member states of RECAINSA, to identify what are the elements of the global strategy that countries have that individuals have done to advance national transformation. I think the work that you all do on the ground in terms of developing communities of practice, in terms of implementing solutions on the ground, help build confidence that digital health solutions can solve real health system problems. I think it's critical to continue to conduct evaluations of the work that you're doing and write those evaluations up in peer-reviewed journals so that they can be used in building and strengthening the evidence base for what works in digital health. And hopefully each of you, especially those of you who are not members of government, can serve as advocates to push and encourage our government leadership to consider digital solutions where analog solutions are currently in place, where digital solutions make sense and are appropriate in that particular context. So you are the ones who know best the situation on the ground. You are the ones who appreciate the context that either allows digital tools to be used or that impedes digital tools to be used. So I think, there are many different roles that members of the ecosystem should play in advocacy, in implementation, in evidence generation, and in also, I'll leave you with the importance of strengthening community, right? So the reason I love RECAINSA, the reason I love Helena and Eichen so deeply is because these are communities of practice that inspire countries to look at each other and say, you were able to do this in the neighboring country. Why have we not been able to do this? What do we need to do? What do we need to invest in terms of enabling environment? What do we need to invest in terms of people and systems in order for us to learn from your example next door and maybe even improve on that in our country? So peer-to-peer learning opportunities are absolutely central to move the needle forward. It's not a competition, it's a collaboration. And so, the more we collaborate, the better the outcomes will be.
Por favor, siéntanse en la libertad de hacer las preguntas en español y nosotros tenemos a nuestros super intérpretes en la parte trasera del salón que nos van a ayudar a traducir sus preguntas.
I understood all of that, so no problem.
Okay, I have more questions for you, so please don't go. En este lado, por favor.
because there's no way for me to see you, right? There's no camera.
No. I'm in the front of the hall, so there's no way you can see me.
I'm just imagining. I'm imagining the room in my head, so I see.
Yeah.
Fantastic.
That's why you needed to come.
Hola, buenos días.
Buenos días.
Yo soy Isabel de Chile, represento a la red universitaria de telemedicina. Quería hacer una pregunta muy simple. ¿Cuál es el mecanismo a través del cual nosotros, como entidades pequeñas, podemos acceder al apoyo de la OMS, que es una institución que se ve muy lejana, muy inalcanzable de repente? Y creo que lo que usted plantea es muy importante, o sea, la instancia de ayuda está presente, podemos hacer solicitudes y utilizar los recursos, pero ¿cuál es la vía de acceso para instituciones que no son grandes, pero que sí tenemos iniciativas, ideas y proyectos? Eso, muchas gracias.
Gracias, Isabel. Quisiera saber si alguien tradujo la pregunta para el doctor Labrique. Okay, I will try to. We have a big challenge here.
Of that. No, I just need the 10% translation.
Okay, perfect. She's
so
Isabel.
How smaller institutions can access.
That is correct.
What exactly?
That is correct. Yes.
So what did they want to access?
Yes, yeah. She's representing Rute from Chile. So she would like to know how small organizations like Rute or others in a region can access to the support of WHO.
So I think most importantly, all the technical guidance and resources that WHO and all of our regional partners, PAHO and WIPRO and CRO publish are free and available openly online. So all of the tools that I have shared with you today are completely free and are available on the internet. So there are, for telemedicine, which I think you were referring to, there is a great deal of fantastic advice that has come out in the past few months on telemedicine, and so it's available online. It gives you, and here's the let me just share my screen. Hopefully you guys can still see, but you can see here that this is the consolidated telemedicine implementation guide. There's older documentation on telemedicine, but there's frameworks for implementation of telemedicine services, implementation of telemedicine during COVID-19, telemedicine for assessing maturity of health institutions. So, there's a lot of useful tools that are available, and I would say we're happy to help you find those tools if you're interested. So, and I know PAHO has a lot of fantastic technical material on telemedicine as well, which they have really been leading on over the last several years. So, yeah.
Alan, we have another question from Orlando Fajardo from Colombia.
Hi,
Hi,
thank you. Yeah, well, can you comment on how the countries with different levels of technological infrastructure and healthcare challenges can tailor their e-health strategies as per the toolkit to effectively address the unique needs of remote and unserved communities?
Yeah, it's a very good question. And I think this is why, for me, the most important investment that can be made, first and foremost, at a country level, is in governance, right? So establishing national bodies that have the responsibility to steward digital transformation. So this is the body that helps create the regulatory environment, that helps create the enabling architecture within which these systems will operate. and that helps create the parameters, the standards that should be used for these systems to work. Kenya, for example, just published 1 month ago a Digital Health Act. So a parliamentary act that enshrines the development of a coordinating agency, what will be the budget afforded to that agency, what will be the roles and responsibilities of that agency. And then outlining areas of priority, such as telemedicine, such as stock management, etc. I think for countries, there has to be a very clear vision of where the country would like to go in the future, but also an assessment of the current state, which if you look at the digital implementation and investment guide, there's a 9-step process that begins with defining what is the current state of technology infrastructure. And once that is defined, that helps to understand what are the areas of investment needed to be strengthened, and what are the current technologies that could be deployed given the current state of infrastructure. I think one of the key things that we have to keep in mind is that we can build for an interoperable future without having an interoperability environment in place, right? So by using standards-based development approaches, we build the pieces of Lego that can in the future be connected once that interoperability architecture is put into place. I think the existence of very, very robust open standards like HL7 Fire that many countries around the world are rapidly adopting gives us that opportunity to build now, given maybe modest to low levels of infrastructure, for a future when there will be a much better infrastructure in place, at which point we won't have to throw away all of the investments we have made, but we'll be able to reuse those Lego blocks to connect together once that infrastructure is put into place.
Thank you very much, Dr. Labrique. Tenemos espacio para una pregunta más. We have one more question, Dr. Labrique, from Mr. Frank Smith from Transform Health.
Frank, go ahead.
Hello, hi Alan, a very great presentation, thank you so much. I just wanted, so we're here in Latin America where there's a lot of population movement and lots of transitory migratory populations. I wonder if you could share some reflections on the role of digital technology and organizations like WHO in creating an enabling environment to support, are you still there?
I'm here.
Oh, I thought the question was offending. In supporting and creating mechanisms to support mobile populations, and in particular reflecting on the need, where accountability lies for cost, for responsibility for these mobile populations, and how digital technology can overcome some of those, maybe some of those sort of restrictions that are sort of confining us within this kind of notion of sovereignty.
Yeah. So as a civil society organization, I think Transform Health is well placed to help provide leadership in answering that question in many ways. So hopefully members of the audience can come and ask you the same question, and I think, you know, Transform Health has done a lot to bring these different actors together. I think, you know, public health is the responsibility of government in many cases, but it's not the sole responsibility or the unique responsibility. In many cases, we recognize that this is a shared responsibility. Private sector often plays a big role in delivering care in systems that are hybrid systems where you have a lot of public sector and private sector care outlets. But there are also very many non-traditional actors in this space, telemedicine providers and issuers of tests and certificates for health status. I think one of the key aspects to your question is the sovereignty and ownership of data always resides with the individual. So part of where we are trying to go with digital transformation is a future where individuals have access to their health data when and where they need it, and they have the right to provide access to their data to providers who need to see their information. And so, I shared with you the trust architecture a few moments ago, and one of the things I shared with you was this picture of an international patient summary, which I'll put back on the screen. I'm not sure if it's bright enough for folks to scan, but this is an example of a new global ISO standard of presenting information that draws upon my health record. This is a demonstration, it's not my actual health record, but where an individual crossing a border can carry with them a representation of their key health information. So in this case, it is my surgical record, my medications, my vaccine record, my diagnoses, etc. And that provides, in the case of an emergency, a much richer set of information to treat me in a foreign place than if the provider was starting from zero. So we're working right now with countries around the world with very different socioeconomic backgrounds to see how this kind of infrastructure can be put into place, providing that basic dignity of having continuity of care and a persistent health record, follow the patient where they are in the world and where they are in their health journey. So I think it's things like this where we constantly have to ask ourselves, is the way things are today patient-centered and convenient for the individual? Or is it hospital-centered and convenient for the physician or for the medical technologist or for the nurse? And if that's the case, is there a way for us to use technology to bring care to where people need it, to bring health information to where and when people need it? And I think that's what we talk about when we're talking about transformation. It's really about, what can we do in reimagining health systems in the era of smartphones that we can use to optimize the experience of both staying healthy and of seeking care when it's needed. And I think that's the challenge I'd like to leave you all with is ask yourself, are we doing this a certain way because it's the way we've always done it? But is there a way to fundamentally rethink how this service is delivered that will make it more patient-centered and more equitable and more accessible and more affordable for everyone? So I think that's our big challenge going forward in the coming years is not just taking a paper-based process and putting it onto our digital systems, but drawing a line in the sand and saying, what is it we are trying to accomplish? And given technology, what's the best way for us to make that happen?
Thank you very much. Un aplauso, por favor, para el Dr. Labrique. Thank you, Dr. Labrique, for this valuable time and looking forward to continuing collaborating with WHO from RECAINSA in Latin America.
Have a great rest of your meeting, and I look forward to seeing you all very soon.
Thank you very much.